welcome to Local Doctors on Call. I'm Cathy McCabe. Each year, cataract surgery enables millions of people to improve their vision. It is one of the most frequently performed and successful operations in the world today. Although cataract surgery has been performed since ancient times, we've seen remarkable advancements in the last half century. Joining us on the show tonight are Dr. Cathy McCabe and Dr. Susan Beck. Welcome to Local Doctors on Call. Thank you so much for joining us.
Thanks for having us.
Dr. McCabe, you have recently been named a Laser Vision Top 100 surgeon, and you're included on the Premium Surgeon 250 list of leading innovators in premium IOL cataract surgery. But tell our viewers a little bit more about yourself.
Well, I practice here in Sarasota and Bradenton, and I actually come from the Northeast originally. I did my residency training at Bascom Palmer in Miami, which a lot of people know about.
Okay.
It's a very famous eye hospital there. We have 5 children, and we are very much enjoying living here.
That's great. 5 children. That's
Yes.
awesome. And Dr. Beck, I know you are an optometrist,
Yes.
and you have an office here in Sarasota. Tell our viewers a little bit about yourself.
Sure. Well, I'm originally from New Jersey,
Okay.
and I went to optometry school in Boston, so New England, and where I met my husband, who's also an optometrist, and we practiced for about 12 years in the Washington, D.C. area, Virginia, Maryland, and D.C., and we came down to Florida on a vacation and said, why not? Let's stay here. So we were able to transition ourselves from the D.C. area over to here, which we have no regrets about. And we have a private practice in Sarasota as well, serving the patients throughout Sarasota. And we just enjoy our lifestyle here, and the clientele here is much different than what we were serving in the DC area. So I do definitely enjoy the change that we've made and eager to continue.
And you're kind of known as the optometrist in town that has the dog, right?
Yes. People come sometimes, sadly, to see my dog more than me, but Stella's our boxer, and people just fall in love with her. She's just a great mascot.
So
yeah,
she's really a super sweet dog. Hopefully you'll meet her.
Yeah,
one day.
she's a great girl.
That's great. So our show topic tonight is cataract surgery and the evolution of it. So first, Dr. McCabe, why don't we just start with the basics? What is a cataract? And we have this really cool display that we can actually show people.
This is a giant eyeball, obviously
Yes.
bigger than yours or mine.
Yes.
But it does show very nicely what a cataract is, because you're right, a lot of people don't really know. It's inside the eye that we have the lens of the eye, and that's actually part of the eye that focuses the light. So light passes through the front window, called the cornea, through the pupil, the black spot in the middle, and then through the lens, which actually bends the light and focuses it on the back of the eye, the retina. And so when we're born, our lens is sort of like a clear jello. It's very deformable, it's clear, it's translucent, like this lens.
Okay.
And as time goes on, I like to say that rather than as we get older.
Right.
As time goes on, the lens becomes more and more dense, and it
Gotcha.
can actually become cloudy. It can become yellow, stiffer, and it really can become even like leather or a rock over time. So this represents a very mature cataract. In the United States, not very many people wait until their cataract is as bad as this, because you can see it really doesn't let any light through at all.
Right.
And a patient with this kind of an opacity probably can't see anything other than motion or maybe the light turning on and off.
Right.
So you can go blind with cataracts, actually. It's the leading cause of blindness in the world today, but it's completely curable by taking a cataract out.
Wow, interesting. Well, we have so much more to talk about tonight, but we do want to remind our viewers that our phone lines are open. If you have a question for Dr. McCabe or Dr. Beck, please give us a call, and the number to reach us at is 361-4675. So I know you've been practicing for a while, not crazy long time, but a while. But how many, it was surprising to me, how many cataract surgeries have you actually done?
Well, more than 30,000 cataract surgeries, but I have to tell you, I still love doing cataract surgery. It is actually the most fun that I have any day. So,
Really?
yeah, I hope that I get to do many, many thousands more in the future.
It must be rewarding to know that you're helping someone really see again.
It really is. I always say I get to do the happiest surgery, because I take a problem, you know, your vision, which is very near and dear and important to everyone. And usually in the United States, we do cataract surgery before it's really a terribly debilitating disease. But we do surgery and we make patients see better, in a lot of times, better than they've ever seen in their entire life without glasses. So
Right.
it's just a happy, quick, easy, and painless surgery.
Right.
So yeah, I have a lot of fun doing that, actually.
So Dr. Beck, after a patient has gone through cataract surgery, that must change how you react with them, and how I'm sure that changes their vision tremendously when you deal with them.
Oh yes, I have to say that I don't think I've ever had a patient who regretted having cataract surgery. They've only improved their lifestyle, their vision. I have one lady who is an artist, and she came to me and she seemed a little bit disappointed at first, and I couldn't figure out why. And she said, this entire time I thought my back porch was a certain color, and after I had the surgery I realized it was a horrible color, and I don't know how I picked it out, and now she had to go and pick out new furnishings and new paint. So that was the only reason she was a little bit upset about having the cataract surgery. But other than that, you know, it is amazing. People, their reactions to the colors and to the brightness, and they thought they had to change all the light bulbs in their house, and they had cataract surgery and they realized everything was fine. I've had people invest in new TVs because their vision wasn't good, and then they got the cataract surgery and they could see things again. Exactly.
That's amazing, because I
Yeah.
guess you just get used to it as it gradually, you know, gets worse over time.
Gradual,
Yeah.
and we
You
adapt.
accept
and
what you see, and you
Right.
don't realize
don't
it.
realize it. That's
Yeah.
Unbelievable. Well, we do have a caller on the line with a question for one of our doctors. Hi, Rosemary. Welcome to the show, and go right ahead with your question. Are you there? Go ahead. Go right ahead with your question, but speak up if you would for us.
This is Rosemary.
Hi, Rosemary.
I was going to ask the doctor about macular degeneration.
Sure. What's your question about macular degeneration?
Well, I wanted to know if they're doing any work at all on a treatment for it.
Yes. Well, you know that there are two types of macular degeneration, and the type that we become most concerned about is the wet type. And the reason that we are more concerned about that is because it can result in sudden and severe loss of vision. That type, fortunately, has had a lot of research where we now have some very good treatments. That involves having some medication placed inside the eye, usually on a monthly basis. And there are 3 or even 4 different choices for medicine now for wet macular degeneration. There is a lot of research going on as far as delivery methods, so that it might be that you don't need to have that placed every month, but much less frequently than that. Only about 5% of patients who have macular degeneration have the wet type, though. The majority do have the dry type, and the research that has been most fruitful so far has been that regards lifestyle changes, like nutrition or not smoking, things like that. There are other studies ongoing, but we don't have anything right now that will reverse the changes that have already occurred from dry macular degeneration, unfortunately. But the good news is this is a very, very active area of research, and I feel confident that we will have something that we'll be able to offer sometime in the future.
Thank you so much for your question, Rosemary. And I just want to remind everyone too, when you're asking your question, if you turn your television set volume down, it'll be a lot easier to hear yourself and hear the doctor's response. So thanks again for your question, Rosemary. And we have another caller on the line. Hi, Harold. Welcome to the show, and go ahead with your question.
Yes, I want to know when you can drive your car again after you've had surgery.
Sure. After cataract surgery, I'm assuming your question's regarding cataract surgery. A lot of times patients, even the next day, will have driving vision from the eye that previously couldn't even see well enough to pass a driver's test. So it just depends on some factors, like if you have a lot of astigmatism, we can correct astigmatism at the time of your cataract surgery and give you that excellent vision right away. But if you elect not to have that corrected, it may be that you need to have your new glasses before you can see your best. So it a little bit depends on the situation for you individually, but many, many, many times you have driving vision even the next day after surgery.
Yeah, I get patients who come to see me the day after cataract surgery and they drive themselves.
That's
so
amazing.
you know, and they cannot believe that they're doing this.
Yeah.
So
Yeah, it's very, very frequent that it's that quick, really. The day of surgery, typically patients are pretty dilated, and so they may not feel as confident with their vision. But really, if you have a bad cataract, we take it out, we put an implant in that's right for your eye and correct for your distance vision. Right afterward, you can see a lot better, even to have driving vision almost immediately. So
And to see how bad your porch looks, right?
Exactly. Then you drive right to the Home Depot and get that taken care of.
I was going to comment on your story because I've had a patient, I remember one time a patient looked at me the next day and she said, "I am so angry with you." And I was like, "I'm so sorry. Why are you so angry?" "I am so angry. Before surgery, I had no wrinkles." And she said, "And my husband was a lot better looking." I said, "Really, really, I had nothing to do with that. I'm so sorry."
That's great. So after 30,000 cataract surgeries, I'm sure you've seen a lot of changes in technology, implants, lenses. Talk a little bit about some of those advancements and why really we're so lucky today if we happen to have this happen to us.
So true. And I feel so fortunate to be practicing today as a surgeon because I have so many more tools available to me too. So one of the big changes that happened is traditionally we took cataracts out when they were ripe because we made a very large incision and took the whole cataract out as one unit. And as you can imagine from looking at the model, that was a big incision. It required a lot of stitches, and the recovery was very slow, and the risks were significant. But what was developed was actually technology that allowed us, called phacoemulsification. It's an ultrasound technology, and it allows us to break up the cataract into very tiny pieces and remove it through a very small incision now that doesn't have as many risks and doesn't even need to have stitches to close. So that was a huge change. And that actually does have an interesting story as how that was developed. And it was a surgeon who was doing cataract surgery who was having his teeth cleaned by a similar technology, an ultrasound, and thought, you know, if this can break up the tartar and plaque on my teeth, maybe we can adapt that ultrasound technology to breaking up a cataract. And so the first cataract phacoemulsification unit was huge. It was suspended from the ceiling. It was giant. The surgery took forever. But thank goodness for innovators like that, because now that's what allows us to do the surgery very, very quickly and through a very small incision.
That's amazing. And no blood even,
And
right?
no blood, because we go through the clear cornea where there are no blood
That's a
vessels.
plus.
So it is a big plus. So quick healing and a smaller incision. So originally when the small incision was developed that way, the implants, which we didn't really talk about implants, but once that cataract is taken out, we put an artificial lens in its place.
Oh, wow.
And this has to enter the eye, and it's smaller than the cataract was, but it's still fairly large. So originally implants were put in just in this shape, and they had to go through a little bit larger incision. The next development was actually foldable implants. So today, this shape of an implant can be put into a little device that folds it up into a very small profile, and that enters the eye and then expands and unfolds into place. So that keeps the incisions even smaller. So that was another advancement that happened. And more recently, in just the last few years, we've had laser technology that now allows us to make all the incisions in the cornea, the opening in the front of the cataract, even softening the cataract with laser so that it's done more precise than we can possibly do as human beings.
And I know we actually have a really cool animation that we're going to show a little bit later in the show, but we do have a caller on the line, so let's go ahead and take her question. Hi Mabel, how are you? Welcome to the show.
I'm good. How are you?
Good, thank you. Go right ahead with your question.
A couple of years ago, I was in California, and the doctor did examine my eyes. I'm a diabetic, so, of course, you have to have your eyes checked often. And he told me that I had cataracts. He said they haven't got to the point that they need to be taken out. But he says if your vision gets really blurred, then you let me know. Well, I moved to another state, and during the transition, I haven't had my eyes checked in a couple of years, so since I'm in Florida now, I was looking at the doctor and everything. I'm going to need to be checked. Are you asleep when you do all of this, or are you woke, or what? when you cataract surgery?
That is a great question, and one that a lot of patients are concerned about when they see me for cataracts. So number one, first I want to say, as you are very well aware, when you have diabetes, it's really important for you to have that dilated exam once a year. And that allows us to see if there are any changes from your diabetes that we need to treat to preserve your vision. So you're right, you need to see somebody sometime very soon. As far as cataract surgery goes, we do give you a little bit of medicine by vein so you're nice and relaxed and comfortable. Your eye is already numbed up just with drops themselves. And in our office, we have somebody actually hold your hand so that if you're concerned or anxious or feel like you just want to be a little bit more out of it, we can give you more medicine. But really, the surgery takes less than 10 minutes. A lot of patients will talk during their surgery, which I don't mind as long as you don't talk with your hands and move about. And so, you'll be comfortable, you'll be in a happy place, but you won't necessarily be put to sleep. We don't purposefully put you to sleep. If you're so relaxed you fall asleep, that's okay, but we don't try to make you fall asleep. You'll just be in a happy, comfortable place.
And also really important to remind viewers that the Eye Associates does free cataract seminars weekly. So for someone like Mabel who's thinking about it, she can definitely come and go to a seminar.
It's a good way to get more information and get your questions answered.
Definitely. And we'll have much more with Dr. McCabe and Dr. Beck in just a minute after this quick break. Stay with us.